Hi everyone, this is Abby, PGY2 Oncology Pharmacy Resident. And for this presentation, I wanted to share the results from my year-long residency research project entitled Impact on Patient-Centered Outcomes for Oral Chemotherapy Prescriptions Filled at Monument Health Home Plus Specialty Pharmacy versus Other Channels. My co-investigators on this research were Jan Lowe, Leonard Petrick, and Carrie Berry. For background of this presentation and research project, looking at the development of new oncology therapies, this has increased substantially since the early 2000s. More interestingly, the area of oral oncology is rapidly expanding. Approximately 25 to 30% of all oncology agents are now in the oral dosage form. Due to a lot of the complexity of initiating and monitoring patients on oral chemotherapy, pharmacists have really become an integral role in the care of these patients. In addition, non-adherence to specialty medications has been associated with poor clinical and economic outcomes. Looking at the use of a specialty pharmacy, this really provides the necessary patient care services that are really required to successfully manage these therapies and also support patients in ways that another outlet would not be able to achieve. Looking at expanding pharmacy services to capture and retain oral chemotherapy prescriptions within a specific institutional pharmacy is really challenging. Unfortunately, a lot of this has become dictated by insurance companies, with a lot of companies encouraging the use of mail order specialty pharmacies because they believe that this will cut costs and lower the overall prescription drug costs. Fortunately, within Monument Health, patients do have the opportunity to fill with specialty pharmacy, our own institutional specialty pharmacy, if their insurance does allow. So for this presentation or project, looking at the objectives, the primary objective of this research was to evaluate the adherence rate of patients who fill oral chemotherapy prescriptions at Monument Health Home Plus Specialty Pharmacy versus those who fill their oral chemotherapy prescriptions elsewhere. And I listed this as via another channel. And I really looked at all channels, so this could be mail order, another specialty pharmacy, really anything, even the VA. So I compared Monument Health prescriptions to any of those other channels. Secondary objectives that I looked at included assessing the time to the first fill, as well as assessing overall patient survival. Methods for this research project, looking at the study design, this was a retrospective observational chart review, and data was collected via the electronic medical record. My dates of collection were from July of 2019 to July of 2020. I included a broad range of patients. They had to be age 18 years or older, and then they had to be prescribed an oral chemotherapy agent from an oncology provider located within the Cancer Institute at Monument Health. I excluded patients from my research that were considered to be vulnerable populations, so those that are cognitively impaired, prisoners, or those who are non-English speaking. For data that I collected, I looked at the age range, the gender, the malignancy type and stage, the oral chemotherapy prescriptions or agents that were prescribed, and then their cycle days, the filling pharmacy, the patient's adherence rate, time to first fill of oral chemotherapy prescriptions, any documentation that was in the chart related to adherence and filling delays, if that was applicable, and then overall patient survival. Looking at the outcomes over here on the right-hand side, for the patient demographics, 54% of the patients were male out of the 150 that I evaluated. The most common age range was 71 to 80 years of age at 35%. Looking at the malignancy type broken down here, 33% of the patients had multiple myeloma, 11% had prostate cancer, 10% had breast cancer, 10% had CML, and then 36% had other for their malignancy type. Out of the 150 prescriptions filled at Monument Health Home Plus Specialty Pharmacy, we were able to capture 66 or 44% of those prescriptions. Looking at other channels, That was 84 of the 150 prescriptions, or 56%. Now, I wanted to note that 50 of these prescriptions were for lenalidomide, or Revlimid, and currently with how the contract negotiations are set up with the manufacturer and the filling pharmacy, Monument Health is not able to fill that product. Therefore, when you look at the chemotherapy prescriptions that we were actually able to capture, I looked at 50 patients on Revlimid and then 100 patients that were not on Revlimid containing therapy, so general oral chemotherapy. So I had the cohort of 100 and then 50. Now, if you look at that, out of the 100 prescriptions that we were able to actually have the potential to retain within Monument Health, we were able to capture quite a few of the oral chemotherapy prescriptions, which was very encouraging. Looking at the overall adherence rate, those patients who fill at Monument Health Home Plus Specialty Pharmacy had an adherence rate of 97% versus 94% at other channels. I anticipate that both of these values are likely hyperinflated just because looking at the chart review, I am able to see when the patient filled drug and then when they refilled drug. So I'm able to tell when patients have drug in hand, but of course I'm not able to tell day to day if those patients did indeed put that product in their mouth and take that product. Looking at the time to first fill, within Monument Health, if we're able to keep these prescriptions within our institutional pharmacy, the time to first fill was 1.53 days, versus if we're having to outsource these prescriptions to other channels, the time to first fill on average was 6.27 days. Looking at overall survival for patients who filled at Monument Health Home Plus Specialty Pharmacy, 44 of the 66 prescriptions that we were able to keep, those patients, 44 of them were alive, or 67%. 15 of the 22 deceased patients had stage 4 disease. Looking at other channels, those that were non-Revlimid prescriptions, 27 of the 34 patients were alive, or 79%, and all 7 of those that had passed away had stage 4 disease. Looking at finally the last cohort in the other channels of just the Revlimid prescriptions, 47 of the 50 patients were alive, or 94% survival. Looking at this data now, I wish I would have maybe set up this research just a bit differently because I had a cohort of patients who were on oral chemotherapy for a variety of malignancies that were stage 4 disease. And usually, as we all know in the oncology space, if a lot of these patients are on oral therapies, a lot of them are going to be indicated third, fourth line, and some of our last line agents. Therefore, some of the survival outcomes may not be that favorable, as we saw with some of this data. Now, I compared that to a cohort of patients on Revlimid, which is a maintenance medication, and so obviously I think the overall survival data is a bit skewed to favor that. This was a really good experience, though, just because I think it shows that we have data, and not all data is bad data. We just have data, and as long as we can explain that and really glean insight from that, I think it's valuable as well. In conclusion from this research, patients are more adherent to and receive medications timelier if they're filling their prescriptions at Monument Health Home Plus Specialty Pharmacy versus other channels. Now, every chart that I reviewed, I did review if there was any documentation related to any filling delays or just general dissatisfaction with the pharmacy that patients were filling at. Now, this occurred only for prescriptions that were filled at other channels. I did not find any documentation related to filling delays or dissatisfaction when those patients were filling within Monument Health. And ultimately, ideally moving forward, having the ability to retain Revlimid or lenalidomide prescriptions within Monument Health would really allow our institution to serve unmet needs for a very large patient population. Thank you.